An investigation into the most atrocious incidents in British medical history revealed on Monday that British authorities and the nation's public health service concealed the truth about the tragedy for decades, while purposely exposing thousands of patients to deadly infections through tainted blood and blood products. As per the shocking data, around 3,000 people died in the UK and many more were diagnosed with lifelong illnesses. Through the use of tainted blood supplies from the National Health Service, around 30,000 individuals suffered from haemophilia tendency and were infected with HIV and hepatitis C between the 1970s and the early 1990s.
What I've been dealing with is people from families across the UK who went into hospital for treatment. And over 30,000 came out with infections which were life-shattering. More than 3,000 had died, and deaths keep on happening week after week. So I'd like people to take away the fact that this is not just something which happened, it is happening. It was, as I say, a disaster which was no accident. People put their trust in the doctors, in the government to keep them safe, and that trust was betrayed. And then the government compounded the agony by repeatedly saying that no wrong had been done. And yet, they said, the people had the best available treatment at the time, and they said there'd been no delay in introducing testing of viral products, viruses in blood. And both of those were untrue.
Deeply disturbed by witnessing the pain of thousands of patients affected in the decades-long scam, British Prime Minister Rishi Sunak expressed apologies on Monday when a withering investigation revealed that the scam was covered up and mostly averted. Sunak apologized sincerely to the House of Commons, referring to the long-awaited report's conclusions as a day of shame for the British state.
This is a day of shame for the British state. Today's report shows a decades-long moral failure at the heart of our national life. From the National Health Service to the civil service, to ministers in successive governments, at every level, the people and institutions in which we place our trust failed in the most harrowing and devastating way. Today I want to speak directly to the victims and their families, some of whom are with us in the gallery. I want to make a wholehearted and unequivocal apology for this terrible injustice.
He vowed that whatever it cost would be paid to victims. Furthermore, the government is likely to reveal a package with a total estimated value of more than £10 billion for the victims of the tragic medical accident. The severity of the incident, according to former Judge Brian Langstaff, whose report has revealed about the medical scam, is horrific. And he claimed that false promises of good care and constant denials had made people suffering worse. Despite the fact that it was already clear by the early 1980s that blood could potentially transmit the AIDS virus, his research discovered that governments and medical experts had failed miserably to prevent the risk. Adding to this, he mentioned that the report indicated that blood products were supplied from overseas, notably the United States, where drug addicts and prisoners were used as donors, and shockingly, the donors were not adequately checked. There were also attempts to conceal the incident, as evidenced in the reports that Health Department staff destroyed records in 1993. Judge Brian Langstaff concluded, "I have to report that it could largely, though not entirely, have been avoided." For the unversed, former Prime Minister Theresa May approved the investigations in 2017 into the scam following mass protests by activists who desired to expose shortcomings. Thus, during the investigation, The team reviewed testimony from over 5,000 witnesses and over 100,000 documents over the course of several years.